2023. We have two important items to go through. So before we do that, as the custom, we will introduce ourselves to each other. So before you talk to your microphone, I was told you have to press the right side of the button because the left side is not working. Therefore, press the right side of the button, introduce yourselves, and then switch it off. Okay, thank you. I am Councillor Paul Egil-Shelvan, Councillor for Cramlington South East. I chair this board. And
Hi everyone, Graham Sayers, GP in ANIC, and I'm a clinical lead at North East North Cumbria ICB.
Morning everyone, Jill O'Neill, Exec Director, Public Health. Slight cough today.
Councillor Liz Simpson, New Biggin.
Peter Stanfield, Chair of Health Watch Northumberland.
Abby Conway, representing Thriving Together, which is the VCSE support system.
Good morning, everyone. I'm Jeff Watson. I'm an elected councillor for Amble Westworth Warkworth, and I'm also a cabinet member for Healthy Lives.
Hello, everyone. Neil Bradley, Executive Director for Adults at the Council.
Morning, everyone. I'm Graham Binning. I'm the Chief Fire Officer at Northumberland Fire and Rescue Service.
Good morning, I'm Jane Lothian. I'm here representing Northumberland's Local Medical Committee.
Morning everyone, Alistair Blair, Exec Medical Director at Northumbria Healthcare.
Good morning everyone, I'm Sam Rennison, the Chief Superintendent for Northern Area Command.
Good morning everybody, I'm Kevin Waring, Superintendent at Northumberland.
Good morning, I'm Gail Wilkinson, Acting Associate Nurse Director for Community Services for CNTW.
Hello, I'm Rob Murphy, Director of Housing and Planning at the County Council.
I'm Liz Robinson, Senior Public Health Manager, Public Health at the Council.
I'm Leslie Bennett, Democratic Services.
Last but not least, Emma Richardson, Poverty Lead, Northumberland County Council.
thank you very much. I think we are being live recorded, so therefore if you're keeping your laptops or mobile phones open, so be aware that it might be captured by the camera. Okay. So the first item is apologies for absence.
Apologies from Sherry McCartney, Victoria McFarlane-Reid, Councillor Wendy Patterson, Councillor Guy Renner-Thompson, and Hilary Snowden.
Thank you very much. And you all been given the minutes of the previous meeting, Thursday, 9th of November. Can I pass this on as a true record of that meeting? Is that okay? Thank you. Yes, Pete. Yes, Peter. Sorry?
Apologies. Could I suggest one amendment at the bottom of page 7, the third bullet point from the bottom?
Page 7. Yes.
So congratulations to whoever succinctly summarised what was probably a much longer contribution. It does miss one distinction. If we could add a little phrase at the end just to point out that the communities we're referring to there are not just of place but also of interest, experience, identity, etc.
Yeah, that's okay. Yeah, we will do that. Thank you very much, Peter. And anything else? Right. Now the third item, disclosure of interest. Do we have any disclosures of interest, Leslie? No? No, nothing pre-announced, nothing is been. Thank you. So that brings us to the one of the main items of our update on and refresh the joint health and well-being strategy. The fourth theme we are all eagerly waiting for. I think it will be introduced by Councillor Jones.
Sorry, the microphone isn't working.
Sorry, thank you. This report is an update on and a refresh of the theme of tackling the wider determinants of health, which is one of the original 4 themes of the Joint Health and Wellbeing Strategy. As you know, the Health and Wellbeing Board strategy was introduced in 2018 as a 10-year plan. At that point, the plan was to some extent aspirational, although with determination. 5 years on, we can now see where we need to have specific actions. The other 3 themes have already come before the Health and Wellbeing Board, and this final update is particularly important to me as it seeks to improve people's health and well-being by addressing the conditions within which people are born, grow, live, work and age. All of these have a much bigger impact on health and inequalities as healthcare, as much as health and welfare, as well as healthcare services and behaviours. And these conditions are the building blocks needed for people to have a good life. One of the recommendations is to change the name of this theme from the wider determinants of health to the building blocks of a good life. This is based on research carried out by Frameworks on behalf of the Health Foundation about how public understand health. Surveys of public attitudes have suggested that the public tend to think of health as being about the food we eat or how much exercise we take or the quality and availability of our healthcare services, and often don't see how jobs, homes, hardship and discrimination are linked to health, despite the extensive evidence of the impact of those wider determinants of health in shaping people's long-term health. If the necessary action to improve health and reduce health inequalities is to be taken, we need to increase the awareness of the wider determinants of health beyond those working in the health system. Shifts in social attitudes such as tobacco control and the use of plastics in climate change has only been achieved when it is step by step with broader public opinion. The research which has been carried out found that the term wider determinants of health does not resonate with people. They did understand the metaphor of comparing building a healthy society with that of constructing a sturdy building, that a thriving community needs the right blocks in place. So jobs, pay, housing or education and health qualities mean that for some people these building blocks are missing, are weak or need replacing. So I welcome the option to change the name of the theme to increase that awareness and to make a call to action to organisations and departments outside of the health system to help us improve health and to reduce those health inequalities. Thank you. I'm going to pass over to Liz Robertson now, who's going to take us through the slides.
Thank you for that. Can I say a few words first about this? When we go through this item, I think lots of you will be very, very familiar with lots of the concepts we're talking about. This is what gets me out of bed in the morning in my professional role, for the simple reason that as a town planner, I know full well that planning and public health shared a common point of origin back in the 19th century. Okay, because out of all the types of inequality we can see, the most clearly spatially expressed inequality is health inequality. And that obviously means there's something going on in simple terms in terms of the place that you live in informing at a fundamental level your future life and particularly your healthy life, as well as many other variables. Okay. With all due respects to every profession in this room, this is a real upstreaming issue. And by that I mean, from my perception, the health world, the NHS and allied partners, deal many times, particularly historically, with the symptoms of the problems I'm going to be talking about today. This is about checking, understanding, and addressing the structural problems which cause those, which cause 80% of health problems, already. Okay, right. So where are we? Over the years, we've looked at these issues of the wider determinants of health through a variety of lenses. And when we set up this working arrangements, we wanted to get up and running and tackle some of the issues. So the first tranche of activities were very much ones we could be straight in at, and we're going to be updating some of those. But those aren't necessarily the ones which will always address the structural problems we have with health inequality. So there'll be more work coming later, particularly on a paper I'll be presenting early next year on healthier neighbourhoods, which talks about the quality of housing and place in terms of design. But this really is a checksum on the work we've done so far to get going quickly on the wider determinants of health, the name change, which I fully support, and the next stages. With that, go over, introduce yourself again.
Thanks, Rob, and thanks, Councillor Jones. So, I'm assuming we've all read the report and the appendices, which contains a lot of detail about what we've been doing in the first 5 years of the Joint Health and Wellbeing Strategy. So just as a quick reminder, these were the 4 priorities identified in the Joint Health and Wellbeing Strategy. There's 2 around housing, being fuel poverty and supporting people to live independently, and 1 around employment and the other around transport. So Councillor Jones, she's the portfolio holder member lead, but this actually cuts across 6 cabinet member portfolios, some of which the cabinet members are here today. The Council's Place and Regeneration Directorate Management Team, they've become the owner of this theme, and we've done work with that directorate group on refreshing the Joint Health and Wellbeing Strategy, and obviously Rob is the director sponsor. And it was so refreshing to do this and to see the distance travelled since the Joint Health and Wellbeing Strategy was developed. I think it's the inequalities plan work, I think the impact of COVID, but the other departments of the council just all talking the same language, talking about inequalities much more rather than just stuff they were doing anyway. So yeah, it's been a real noticeable shift. So the report highlighted, I think we were asked to highlight some of the impacts of COVID, and it really has focused attention on some of those building blocks of a good life. It wasn't just around people's age or their health status, but other factors impacted on their experiences through the pandemic, and also the cost of living and energy crisis in more recent years has disproportionately affected those on lower fixed incomes because of how much their income is paid for housing, food and energy. You'll have seen a lot of interest from the government on health-related economic inactivity, with some announcements in the 2 budgets that we've had recently, and there's little sign of that trend slowing down at the moment, particularly as the population ages. Some caveats on the data, you know, the quality was really affected by COVID. A lot of the surveys that inform these indicators used to be carried out face-to-face in people's homes. They went online, and that's affected the quality. So I think we really need to look at data over a few more years to really understand what direction we're going in. And just using that average, it does mask inequalities. The fuel indicator was an example I put in the report, which shows we look not too bad, but when you look at groups, rural areas, lone parents, people living in the private rented sector, how differently their experience is. So this was the first theme that we had. We wanted to see much more access to energy efficiency schemes for people who needed them most. We wanted to have frontline staff much more aware and conscious of the support that was available for people, and really maximise all the opportunities. And this is just a snapshot. Throughout this whole report, this is just some of the things that are happening, and I'm sure Emma will be covering a lot more in detail about the work that's been done around energy and cost of living. So in terms of how we're doing, we're seeing improvements in the people living in with mental health issues, living in supported housing. We're seeing a stable for people with learning disabilities, but we're seeing fuel poverty and winter mortality worsening for the reasons I've explained. So this next priority was around health and work, really, and we've had 2 lengthy discussions in the Health and Wellbeing Board over the last year, so I really think this will be one of your most familiar topics out of all the 3 that we look at today. So this is about having better quality jobs, good recruitment practices, support for people who need it to get into work and to stay in and progress in work. We're seeing that the gap in employment rate between the sick versus the non-sick is reducing, so that's good when we see that reduce. But the general worklessness rate seeing a slight increase. And obviously go to that appendix and you can see a lot more detail about all this activity. So then the third and final theme is around transport. And mainly the focus of this was improving access to public transport and increasing walking and cycling. I think in terms of an action plan, this theme's probably the least developed and been most impacted by COVID. We've seen quite significant drops in the use of public transport, but an awful lot of work being done by the council to with the bus services improvement plan to help people access public transport at low cost, to fill some of the gaps that are created in some of our rural areas. So I think we can see there's been a general increase in cycling. It seems to have increased, but a reduction in walking. But I think that's probably part of the issues with the data. So as Councillor Jones has mentioned, we'd like to recommend a change to the theme name. We'd like to look at housing a bit more broadly than it currently has been, although those issues are still important for groups of our population. We'd like to look at wider strategic housing because this potentially has a much bigger impact on our population, so is more likely to shift improvements in health when we work in that way. So Rob's going to come with my colleague Anne Lawson in January, and you'll have a much longer time to discuss that element. So the fuel poverty indicator, we would like to support that with some other measures around energy efficiency, and also on the housing side look at affordability and overcrowding indicators. Now, some of these indicators aren't ideal, but they're kind of the best we have in terms of a proxy measure. But I think as discussions continue, we might be able to do more about other indicators for that theme. The inclusive economy theme probably will keep the same focus, looking at closing that gap between people with poor health and getting into work compared to the general employed population. But across the whole life course, so thinking about younger people, people with special educational needs as well. And the transport theme, I think it's just more and more of what we're already doing, and sort of constantly refreshing those actions. So a quick look at these. This is all in the report. So how the strategy would look going forward is we'd have a priority around healthy neighbourhoods and housing and planning. We'd have a priority around some of our towns around improving the condition of the housing and bringing health and housing together in Blythe. And finally, a look at more the affordability and quality of housing, also including rurality and what opportunities there are. And also using our role as a landlord to make sure that we are a real exemplar, and also using regulations such as the selective licensing policy to really improve private sector rented housing standards as well. Inclusive economy, again, this follows along the discussions we've had. It's around improving good quality of work and closing that gap. But we would really like a renewed focus. This was in the original strategy, but we would like to have a renewed focus on building on the community promise that Northumbria Healthcare Trust has, and really embracing that as a place. So the council, which also does a lot of work across those themes, but also involving the private sector through the emerging county partnership that you might be aware of. And then finally, just all the activities around volunteering that our VCS partners do. There's one example there, there's many others, as this becoming a stepping stone for people to get back into work. And then transport, that's increasing access to passenger transport, the devolution opportunities that are coming towards us through a combined a broader combined authority with new powers presents much more ability to develop something for the needs of our area. So that will be really interesting seeing how that develops. And around active travel, as you can see from the report, there's lots happening around that behaviour change, but we need to couple that with changes to the infrastructure. So not only do people want to cycle, but they feel safe doing so. And there's a lot of cycling schemes that are being developed, and the council is always developing a pipeline of new schemes to implement. So that, you know, that's really exciting, and hopefully we're going to see much more active travel going forward. So measuring progress, these are kind of what we're proposing to change. We want indicators that we can benchmark ourselves again, that we can track some sort of trend in progress. Some of these are just snapshot indicators which aren't really that useful. We also want to try and use indicators where we can dig below the surface to see where there might be inequalities within population groups. And some priorities, I think it's fair to say, have limited measures that really do this. So this is what we're proposing. It's just a summary of what I've already highlighted. And I suppose it's just a question back to the board. Do these seem right to you? Are there any priorities missing, any sort of more actions rather than the priorities because they're sort of fixed? And do these indicators seem right to you?
Thanks for that. Can I just ask you to keep a few things in mind when we have a discussion about this? Unlike a conventional medical approach of diagnosis and treatment plan formulation, the environment that people live in is very much a complex machine with lots of moving parts. So looking at causal factors is not a simple exercise. But I would emphasise a few things. These are all interrelated. So when we're looking at the economic element, and that getting people into jobs is good for health outcomes, we also need to accept fundamentally that low economic activity rates are caused by endemic poor health. And endemic poor health is caused by low economic activity rates as well. So these things play into each other, and that where you are in your life and where you live, and that's quality of housing, all those issues we talked about, are components of all this. But there is not one single component which is a magic bullet to sorting this out. So we are trying to approach this on a broad basis. So for example, you may have heard in the press lots of stories about the issues of social housing quality and mould and damp issues, etc. So we are part of a very limited national pilot of local authorities working with a new social housing regulator to look at where we can best make a big difference on this. So hopefully when we come back early next year, we can talk about some of the nuts and bolts of putting this into practice. But I would just keep emphasising, this is, it doesn't lend itself to double-blind testing in terms of a medical concept. It is a complex relationship of causal push factors. Thanks.
Thank you, Rob, and also thank you, Liz. I think one gets a very good impression that you really thought through the factors, particularly the causal factors, and then come up with a new revised plan. Thank you very much. I think as a board, we have to do 3 tasks here: to review and agree priorities and actions for this theme. And we have to look at the indicators, because we are putting in some indicators to measure whether we are making progress in the right direction, etc. So that's something we have to review. And also comment on whether the national indicators are aligned to this theme, other measures, if there are any, we have to include to revise the plan. So I welcome lots of questions, lots of comments, and lots of constructive criticism, so that we can take your views on board and then revise it and bring it back. So over to you. Yes, Alistair, thank you.
I really welcome the report, and I think if you think of this as building blocks, actually housing's absolutely fundamental, and it's not just fundamental for now, but it's probably got the longest trajectory because these buildings will exist long after I'm no longer here, and most of, you know, so that has a massive impact of getting it right, and I think it is a building block. So really welcome the report. Two perspectives. One is with active transport. I always feel it's a shame that we're talking about cycle training, but if you go to Holland, they would build cycle lanes with every new estate. We don't, and we talk about persuading people that it's safe to cycle rather than creating the environment where it's safe to cycle and active transport. And it seems a real shame that all of the estates that we're building aren't being built with cycle lanes built into the planning. I know that may be beyond your remit, but it does seem something that, you know, we've got so much building that's going on. So that was one comment. The second is a separate comment, and this is not in any way questioning a decision that's been made, but I think if we are looking at this as a health and wellbeing board, we need to think also that I think we need to make sure that the precedent around 106 isn't extended to other areas, because that is something where I know it's been shelved recently for very specific reasons, but we don't want to see that funding, which is around creating the capital to actually get the resources into health and social care and the wider determinants of health, is sacrificed. And I think it's really important that we make sure that that is a one-off rather than a precedent that other developers use, because it would be a real shame if we are talking about this at the same time as disabling that funding, which actually is a long-term enabler.
Yeah, thanks for that. I think that's a very astute question. And for that, for everyone else in the room, I regularly hear this comment, and the debate is, in Holland, and in fact in Belgium as well, there's a much higher use of cycling as a default method of transport. And people say, but it's flat there. Holland has had a really aggressive policy since the 1970s of requiring cycle paths to be installed. So they've got a really strong network now. It hasn't happened by accident. And the work I've done on the continent on planning, when I've talked to Dutch planners, is that it's been a battle for them all the way through. And I think that's going to be a theme, particularly when we come back early next year, in that we can all sit in this room and say, let's do all the good stuff. But actually, when it comes to a hard decision, and if you are trying to balance up a large new housing estate and its contributions to education capacity, to active transport, to play space, to affordable housing, the argument we'll be making early next year is we should feel confident to refuse applications that do not make the right provision for these issues which are important. Because I think you can look round at society and it covers every bit of infrastructure. The amount of housing estates that were built in the 80s that had no provision included for educational facilities or contributions, you know, is really telling. And I think actually that's what's instilled the default resistance of communities to new housing, because it wasn't done in properly. Yeah, the challenge is we do it properly in the future, and we say we learn from the past. Yeah. In terms of Section 106 funding issues, government has just finished consulting on a new approach, which is a tariff-based system to apply to all development. I'm not certain where that's going to go, but early in the new year, we will probably come with another paper saying what the new developer contributions world means for health inequality interventions. Okay.
Yeah.
Yeah, I also welcome the report. It's really great to hear and to see the progress that's made. With regard the change of name, certainly around building blocks of good life, I think that's a really sensible measurement, because it means it's much more meaningful to people, and I think it aligns that, you know, the kind of accommodation or building blocks, you know, I think it just makes a lot of sense. With regard to the priority one around supporting healthy environments, I would just love to hear social value mentioned in there, and I think that also talks to Alice's point around, you know, how we experience those lived environments when it comes to housing estates. And I think it is a challenge when we try and change what is already there. That's when you get the kind of resistance. But while we're doing new stuff, we can, because one of the things that concerned me was the increase in cycling is brilliant, but actually there's a reduction in walking. And when you don't have a dedicated cycle lane, you're pushing cyclists either onto the road or onto the pavements, and that could potentially have a negative impact.
Yeah. We could spend a lot of time talking about the details of putting this into practice, but the concept we use in the Town and Country Planning Association isn't just about healthier neighbourhoods, it's about robust places. And by that I mean robustness in all its, in terms of social interactions, social networks, employment, all those issues we talk about. And when you look at, when we talk about spatial patterns of inequality, historically, I think a lot of people have talked about inequality in terms of access to healthcare facilities, and it isn't about that. We need to dispel that image, because actually some of the disadvantaged communities do have good access to healthcare facilities, but it's about the actual places themselves. Okay.
You have some questions.
Thanks. A couple of things. I welcome the report. Thank you very much. Just building on the cycling thing, we talk a lot about the railway transport. We don't ever talk about the proposed dualling of the A1, and I'm just not sure I've seen health impact assessments on that recently. And is there an opportunity there in terms of active cycling? We do a lot of cycling for leisure in Northumberland, and I know it's come and gone, and there are political issues around the dualling side of things, but we haven't talked about that, and I just would like to know more about that. We don't need to know more now necessarily, but it was just to flag it. Yeah. The police, full members of this board recently, I'm not sure if you've been in the discussions we've had about active employment and things like that. You are a major employer, I am sure, and I would just be really keen to hear about that as maybe a separate thing at some point, but you're not just a service provider in that sense, you're an anchor institution who employs people, so active employment would be a really interesting thing from your perspective. Thank you.
Yeah, could I just make one point here? And again, I think you made some really interesting points there. In terms of cycling, a real key challenge is the same challenge we face in terms of our leisure facilities, okay? That you need to avoid putting in place interventions or new infrastructure for cycling, say, which only appeals to those who are already active cyclists. In other words, you know, people who are hobbyist cyclists. It's about making it an easy and convenient choice for transport and a cheap one for residents. But like how we look at leisure facilities, we should be focusing our infrastructure for active lifestyles based on the demography of the population, not just preaching to the converted. So the big challenge I'd ask you to think about, and not perhaps answer now, but if we are faced, say, with an ageing population in the county, which we are, how does an active transport and an active lifestyles infrastructure for an elderly population look like? And it isn't long distance cycle paths for those who can cycle 100 miles anyway. Okay.
That's very important. We shouldn't be preaching to the converted. I think we should be encouraging more cyclists to come forward. Yes, Councillor Watson.
It's interesting, Maud, because I was going to say something pretty similar to what you've just said there. What I've seen about this report is that really health and all the things associated with it need to go into a big sort of melting pot, because everything has an opposite and equal force. I mean, you increase cycling, and if we're not careful, will inconvenience pedestrians. So the classic example, I think, is, for me anyway, is, I'm sure most of you know it, between Warkworth and Amble, the path along the river there, which is a cycle path and what do I get complaints from? I don't get complaints from cyclists. I get complaints from pedestrians who say that they're being pushed out by the cyclists going along. So it's something we need to sort of look at it in both ways. And also, when we talk about new estates and we talk about affordability of houses, the more things we put into an estate and ask a developer to do it means that the more he has to charge for his houses. Because he's going to do it, he's not going to make a profit. An individual developer, if he builds a play park it means he can't build 10 houses. So he'll have to put the houses up proportionately. And that's got to be taken into account. We've got to look at all that. Because if we don't do that and we do things individually, we'll have effects that we don't want to see. So I'm really pleased that we're looking at all these things together to make sure that they all interact and balance, and not just do one thing because we think that's a really good idea and not figure out what it's going to do.
Thanks for that, Councillor Watson. And actually, that was the window into my day job, actually. In that ourselves are really charging us to actually not just say yes or no to new housing estates, but to think about, you know, affordable housing, healthy lifestyles, education contributions, ecology, an entire, and issues like community facilities. So the shopping list of issues we are trying to deliver is increasing, and clearly the development industry will argue margins on this. I think part of this, and this is where the paper that we're going forward in the new year talks about, is actually how do you prioritise? Because in some places, affordable housing will be the #1 priority. In other areas, if say the local school is already at capacity, that education capacity might be the big priority. But it's a case of how do we have a robust evidence base that we get the best possible schemes we can do out of the development industry. And all I'll say to everyone in this 1980s that paid no emphasis to all these issues whatsoever. That is the how not to do it. And we need to say is what do we mean by good now and how do we get there? And it's a real challenge. And there will be a pushback against this. You know, there will be a pushback against it. But as I said earlier, if it's an easy decision, then we need to talk about it really. But it will be a hard decision. But the backing of bodies like this who can objectively say, no, this is really important, is really vital for us to gain leverage over this issue. But equally, though, I'll be honest, the people who are interested in ecology will be saying the same thing. The people who will be interested in wanting new village halls will be saying the same thing.
Yeah, just coming back on Councillor Watson's point, I think in the past, health impacts have been quite invisible. So a lot of the work that you'll hear about in January around introducing the health impact assessments to planning, and also the work we're doing in the council around that integrated impact assessment, where we're thinking about health inequalities, equalities, carbon impact, as well as value for money and economic considerations. It's now making it more visible, so the decision making can balance these up, and it's about minimising the negative impact and maximising the positive, not saying, no, you can't do this because it's an unhealthy development. And also thinking much more upstream, so sort of selling the benefits to developers. If you have a healthy development, more people would want to live there, and they might actually even pay a little bit more to live there. So it's about making it much more visible than perhaps it has been in the past, so that they can be balanced alongside those viability issues.
Yes, thank you very much. So firstly, I really like the change in the title and the building blocks. There is a few areas that actually the police are often not forgotten about, but not considered in relation to our contribution to health and well-being. But firstly, that when we talk about the first point, which is around that environmental change, well, that safe space, that open space, the police play a really key part in that, around design of our environment, but making sure that within that, that there is a place that is safe for people to go to use for exercise, for healthy living, and making sure that from a force we are engaged in that planning and involved in that planning, so that we can make sure that we provide that service and that advice and that forward planning that our communities need in order for us to be able to use it safely. The second one, which is in a relation to the housing and development, we need to make sure that from a policing point of view that we are planning ahead with yourselves to make sure that it's not just about providing health services in those environments, but making sure that the police services are fit for purpose. So when we're seeing large growth and regeneration, we need to make sure that we are working with you so that we make sure that my resources are moved to the right place at the right time in order to meet the demands of our communities. And when we talk about employability, we are a huge employer within the Northumberland area. And actually, most recently, we've just done a recruitment campaign at the moment for our police community support officers and our rural officers, where we're specifically focusing on people who live in the Northumberland area. Now, we need to get better at that. We absolutely do need to become an employer of choice for people who live within this community, but not just to work for Northumbria Police, but also to volunteer for Northumbria Police, which is when we can really impact and work with people who are elderly, who might be looking to re-enter employment, and work within the community and really support those people that they live alongside. So there is a lot of opportunity that we can offer from a policing point of view that I'd be really keen to make sure that we are talking to in the document.
Thank you, sir. They're very valuable input to us. I mean, it's really appreciate that. Thank you for being here. Are there any? Yes, Peter.
Thank you. Thanks, Rob, for the report, which is really helpful. A couple of things for me. I welcome the change in title as well. I love the concept of wider determinants. I've lived with it for a long time. But actually, building blocks is much more straightforward. I wondered about the word good. I get that a healthy life is a contributor to a good life, but given the context of this within it, as a theme within health and well-being strategy, I wondered whether building blocks of a healthy life might be a better title.
Building blocks for healthy life.
Yeah.
Thank you. I think it's a good probing question, so I'll leave the Rob.
Yeah, and that is something that frameworks have suggested. I think we felt that maybe that could exclude people outside the health system again, which we're deliberately trying to help people think that of their role. So with the departments in the council, people like the police, whose core role isn't health, might think, oh, well, that's for the health system. So we've added that little subtle tweak. And good life, you know, it's different to different people, isn't it? So whether you've got a disability or you're able or all these other factors. So rather than define what a good life is, it's making sure people have those basic building blocks of housing, a good enough income to have a good life, and you know, access to opportunities. So that's kind of the reasoning behind why we've done that. So hope that explains that.
Can I just add, that is a fascinating question, because actually, conceptually, if a lot of these building blocks, let's call them, work, it will have a positive effect on healthy life, both in terms of life expectancy and healthy life expectancy. But I personally want to avoid any perception that this is just about getting people to think directly about direct participation in active lifestyle, say. Because, well, let's take an example. What the lady from the police just said, okay. If you look at the ageing population in the county, who suffer a lot from anxiety at times about, say, going out at night, there's definitely going to be a health benefit from them feeling safer so they continue to be engaged in society and activities. But it isn't really a healthy aim as such, even as a direct impact on that. So I think a good life, in its broader sense, is a useful concept in terms of engagement. But I think this is what we're here to talk about as a group. And the big thing, and I'm not making any politically loaded statements here in any way, is avoiding at all costs perhaps some of the older language and thinking about this being a personal responsibility agenda. So I want it to be a, you know, places where people can have healthy, good lives agenda. Okay. if that makes sense.
It does, but both of those responses to me suggest that we're not using building blocks of a good life anywhere else in any other strategies. Have I got that right?
No, we are, absolutely, but I think we call them different things in different professional realms. And part of the really good change in the county council has been to look at more integration of strategies and approaches across your place-based activities, etc. Yeah. So, for example, when you look at the acceptability of many initiatives, you look at it through the concept of a sustainability agenda, and people automatically jump to thinking about sustainability being about climate change, say. But sustainability is the correct balance between economic, social and environmental considerations. So that's a different way of looking at this issue. It's the same issue, but it's just a professional realm difference between them. And this is about trying to have really simple language that will engage people who will be put off otherwise by the professionalisation of some of these agendas.
Yeah, a follow up if I may. Yes, it is. Yeah. So we're using this as a theme, title for a theme within a health and well-being strategy. That was kind of why the healthy rang the right kind of bell for me. But I'll leave you with a thought. My second question was actually about education. You refer in the paper to education as a key building block, but we don't then pick it up further on. But nor do we say where we are picking it up. Is that because it's dealt with separately? I didn't quite understand why education isn't addressed here.
So your question is why education is missing, or
yes.
it's not given?
Yes. Kind of Jill to answer this one.
Yeah.
Thank you. Yeah, just to, I suppose, remind everyone that this is one of 4 themes that go across the Joint Health and Wellbeing Strategy. So when we've had the Starting Well theme, then education is picked up within that theme. But also, just while, if I may, have the mic and to say thank you, and it's a great progress report, show where we've come from, but also be a lot more pragmatic and tangible for the next 5 years and the actions that we're proposing here. But also, and it was mentioned briefly, the county partnership will sit above us because as a health and wellbeing board, we aren't responsible for it all. So I think that's something that we're really keen to come forward into 2024, which will align our more senior chief officers and our anchor institutions and such like to look at all of those in totality. But I think hopefully what we've heard today is that strategic framework that will ground us and sets the forward plan for 2024, where, as Rob said, we're going to have a housing and health paper come forward. We've got a community transport paper coming forward, and the Director of Public Health annual report this year is on ageing well as well. So hopefully this theme, you will then start to see that we can dip down into the more detail of each of the topic areas for us to have those more nuanced debates going forward.
So Peter, good question, but I think this is one of the 4 themes, sorry, yeah, and there is one cross-cutting theme, and education is well addressed, as Jill has just pointed out. And I think I like a good life, because we don't want to emphasize too much on healthy, our own name is health and well-being. So the second point is well-being, it's about being good life, having a good life. Yes, Jane, you have been very...
Thank you very much, and thank you again for the report. Having been a veteran of the various actions from the Health Action Zone onwards, we really do seem to be making progress. I've got 2 points which, mainly about rural, there are quite a lot of references to the rurality and the specific health, well, I'd say good living issues. And I just wanted to just sort of flag that but we're getting I say it's a particular type, and I saw this when I was still working in general practice in Coquetdale, that we're getting a sort of subpopulation of people who've moved up from the south, who are now, sort of my age, early retirees, but there's also a very, very ageing population, often quite wealthy, up in the valleys. That, and if we're using markers such as travels to work, uses, cycle as travel 3 times a day, you can't travel from Sharperton to Rothbury, in under half a day, where the nearest shop is. So it's things like that, but also the occupancy of houses, big houses, because regrettably the stock of affordable housing in the more rural areas is token, I think is probably the best word. And you're getting so for instance, there's a large road near where I live, where there's a whole row of large houses, either recently vacated by their deceased single occupants, or still occupied by their octogenarian or nonagenarian single occupants. Anyway, so that, I think it's a smallish. And my other point was, I love this, having championed this sort of non-medical. However, how are we going to tell the population of Northumberland that they're not being done to? They're not waiting for a nice new housing estate where they've got all of this. That how are we telling them what you're doing and all the good work?
Yeah, again, very good points from all the questions today. Yeah, the rural preferability issue to do with the sparseness of our population is a real issue in Northumberland, and it is the one element where sometimes we see a different pattern that isn't just a straight, because many times household income levels or wealth reads across to health inequality. We actually see a difference in the county because of the point you said about an ageing population in an area where they will increasingly, if they've been reliant on private transport, they will be faced with certain problems moving forward. I would say the issue of under-occupancy of housing is a really important one, and it's one we've been looking at as part of our housing strategy work, because the generic response, if you're in an urban area, is have social housing that people can downsize to and thus free up larger homes. The issue is people do want affordable downsizing opportunities in their areas rather than, within an urban area.
I know it's nuanced, but I think it is increasingly important within
It is,
Northumberland.
and we've been looking at a number of schemes, particularly where homes need to be pre-designed, potentially with people who may have, say, Alzheimer's issues as well. And so you can design homes, but this takes us back to the point that Councillor Watson made, is that the volume house building industry will not provide those solutions. Okay. Yes, and yeah, long distance cycle. This is back to my point that health infrastructure for active lifestyles cannot be focused on a perception of those already active. It needs to follow the demography of our population, and that may mean our solutions look very different to other parts of the country.
You want to come in?
Yeah, thank you. A couple of points. It feels like we could sit and talk here all day about this, which is great, because there's clearly a lot of passion in the room. With regards to a couple of points that have been made, I think it's worth reminding ourselves that in December of 2022, so a year ago, we sat here having put wet ink on a Northumberland Inequalities Plan partner commitment. And when we ask ourselves, what are we doing to make sure that the whole systems are looking through this lens, that was our commitment then. I still feel relatively new on this board, and I always try to bring a bit of what am I doing, what is my service doing, what is my contribution, so out with the obvious bits of what people associate fire with, what else are we doing, and what thread do we weave into the rich fabric of what's on offer. So that was a first comment, just an observation. And then I think just around the nomenclature and language is everything. I think if I think about Harry Burns, the Professor of Global Health, Sir Michael Marmot, and the thinking about wellness is not simply the absence of illness. So I think we need to be careful about health, being healthy, being synonymous with having good health, whereas a good life includes having good health. So just offering that as my perspective.
Thank you. Can I say one thing to finish on, if that's okay, Paul? Yeah. Oh, sorry, there's another question. Absolutely.
It's all around mental health, support. You know, we've got suicide prevention as a big target that we've all got to meet. So there's loads of work that needs to happen in that area. And I think that, I know I've said this at this meeting before, it starts with self-esteem building and confidence building in schools for children and young people and goes on to support adults in later life. If we get that self-esteem and confidence building early enough, then that should carry people through. But it's how do we tackle mental health as a massive part of health overall.
Yeah, because I'll finish then. I think that's a really important point, and one of my shorthands for robust places means that in every sense, and a robust place where people feel safe, included, supported, is a really important driver in that. Finally, for a Christmas thought for you all, I want to leave you on this, all that we've talked about, okay? I've got a presentation I do for planning graduates that talks about the need for places to be healthy places, to have good quality homes, to have good quality access to housing, good quality access to education and healthcare facilities, to active space and recreation. And that's really depressing, but really reassuring. It's reassuring that we're doing the right thing, but that presentation is on the Garden City movement, which started in 1893, and that was their guiding principles. So this is just an argument for saying, let's take this seriously and really drive this forward, because we've been struggling for a long time to actually make the hard decisions on this. Okay?
Just a very few quick points. Listening to what Graham said, what have we done in the last year? I'm actually quite proud of what we've done as a council in the last year. We've kept our libraries going and expanded them. We've created warm hubs. And the biggest thing that I'm proud of, it's not in fruition yet, but it will be shortly, is what we're doing with our leisure centres. We have asked for a new management structure, which gives us much more into our equal opportunities, much more into the community association. The previous people did a really, really good job and should never decry. We're changing our route because of all the things that we're talking about here, and we will do a lot in the future. And I'm also proud of our schools. If you don't get your kids' education right, and right at the very beginning, health and everything else will fall apart. And what we are doing is seeing a huge increase in the quality of our education here in Northumberland, and we're still spending lots and lots of money, £100 million on 3 new schools, at least 100 million, I might add, likely to be a fair bit more. And if that's not saying that we're going in a different path and we're trying to do something for our health and well-being, then I don't know what is. So I'm really proud about that, and I couldn't resist from saying this. Thank you, Chair.
Thank you very much, Councillor Watson. Yes, Peter, please.
Sorry, a very quick one. I don't know if you're going to go to talk separately about the indicators. One of the questions you asked us was, are we happy with the indicators? And absolutely, they're good indicators. When I was looking at them, I found myself wondering whether some of the relative movement between the Northumberland and the national figures about getting people with long-term health conditions into work, for example, it just made me think, given the preponderance of older people within our population, I include myself among them, I just wonder whether we're cutting off the working population age 64 along with national statistics, and whether we might perhaps separately want to think about finding indicators beyond the national statistics that might be more relevant for our population.
I think that's an interesting one, because we should equally perhaps broaden out horizontally by what we mean by economic activity. So, for example, volunteering and community work, I think, is as legitimate to count as economic activity as the conventional paid model. Okay.
I'm really pleased by the quantity and the quality of input that has come into this discussion, and that's really good. I think when I became a chair and vice chair and Jill, before that, Liz, we wanted these meetings to be more consultation oriented. So I'm very pleased in every meeting there are a lot more inputs coming in, and this is really good. So thank you very much for all your inputs. And in fact, just a note, in the pre-discussion, Jill and Vice Chair and I meet a week before the meeting just to discuss. I simply asked the question why our strategy, health and well-being strategy, is called Joint Health and Well-being Strategy. So the answer I was given was that it's not the council that does. It's council together with many anchor institutions, which together we are moving forward certain goals. I think that's what's captured by Graham in a way. So that's why the nomenclature, you use the word, that's very important. So it's a joint effort led by the council perhaps, but you are all in it and we are open to all the comments and criticism, questions. Thank you very much. So we agree what we are supposed to agree, okay? Thank you. Simple. Next item is on poverty hardship plan. In fact, it's one of the building blocks of good life, actually. Yeah, it's a very significant one, and that's going to be introduced by Councillor Jones and then presented by Emma Richardson.
Thank you, Chair. I'll start off, though, by just thanking everybody for the discussion we've just had. Everybody knows it really is close to my heart, that discussion. So I'm really pleased that the breadth of the comments are coming in. So we'll move on, though. The Poverty and Hardship Plan is part of Northumberland's Inequalities Plan, and it's the Council's response to financial hardship and the cost of living pressures. We do want to keep residents safe and well during these pressures and to prevent further widening of the equalities gap and support long-term prevention and to take proactive measures in the wider systemic inequalities plan. The plan's been developed and delivered with representation from the key areas of the council, the voluntary community, social enterprise centre, and it provides support for holiday activity, food investment and the housing support funding. It links very much to our previous report, but with greater emphasis on the support, or giving actual support where needed. So the purpose of this report is to bring to the Health and Wellbeing Board an update on progress, and Emma's going to give us that. Thank you.
This one's not working, so I'll use this one. Morning, thanks Councillor Jones. So yes, and hopefully you've all read the report, which does contain a lot of information, and I think it kind of connects really well to the previous work, in that what we're doing is figuring out how we do more in the moments that we get to really build that resilience and sustainability in different futures, particularly around some of our hardship pressures. This is the busiest slide, I promise, and it just details that where the Poverty and Hardship Plan sits nestled in the Northumberland Inequalities Plan, which is a tremendous enabler for all of this ambitious work. It includes the £1 million of the Public Health Reserve, but also the Integrated Care Board. I haven't broken that down as clearly in this presentation because actually the work is integrated, which is of course what we want to hear, but it also includes our holiday activity and food programme, household support funding, and it's about how we pull together to get it right in the moment and also look to get it right in the future differently and better and stronger. For the purpose of the governance arrangements, this just shows where it sits. Councillor Jones said where the plan was developed through, and comes obviously into Health and Wellbeing Board, the cross-party members, Group 4 Inequalities, and we also have a cross-sector and cross-directorate steering group who meet monthly to go through all of the decisions, actions, because there's lots of little pieces of work in this work to tell us those stories, to help shape. I think one of the best, as I was listening to Rob and Liz there, Food is a really important aspect of all of this work, supporting people with food. And what we're trying to do is test lots of different things to understand what community food might look like, what affordable, healthy food might look like. And we don't know the answers to that yet. So that's a good example of how this kind of work feeds through. As I say, a fantastic enabler. These 3 questions: what can communities do for themselves? What might communities need help with? And what can't communities do? That is ours. A lot of this work belongs in that building capacity, understanding and listening, where people are really struggling to see what does make the difference and what makes those long-term differences. So the areas of focus for this piece of work are the hardship support, mitigating the impact, particularly on children and young people in education and in their lives, in their places, as Rob rightly said, the complexity of that, and building that resilience in our households and our communities so we're not forever more managing hardship support. We're starting to figure that out. We know very well the pressures on households, the impact of inflations. We all know that just now, and food prices and energy prices, while they are adjusting in the right direction, that's not happening at pace, and people have used up a lot of their reserves and support networks and so on. Average wages and average spends, we've got a focus on good jobs and good pay, and we know at the minute that's a challenge for some of our households. Universal credit claimants and deductions that are largely with our larger families as well. So what are we doing? How do we make sure we get that right, and what is that teaching us? Free school meals and children living in poverty. And the rural premium, which was mentioned earlier, when we live rurally, there are hidden costs, there are different challenges, and we need to work to understand that, to get it right and support our residents to stay safe and well, but also tell us what does that teach us and about planning for the future and about what happens in those communities and places and what we do strategically in those. And of course, interest rates. There is, I mention that deliberately because what we've seen actually in the last 5 years is people in Northumberland who need support who previously maybe didn't. And that's telling us about different visibility of information and support. People who are paying mortgage rates that they didn't expect and energy bills that they didn't expect, and their life circumstances have changed quite significantly. So we need to just be sighted on what that means, and I'll come on to talk a little bit about Citizens Advice and our other partners. One of the greatest gifts we have as a local authority is that we have access to so much good knowledge in the form of data and expertise and partnership, and a big part of this plan is pulling partners together to figure out how we use that. I was really interested listening to Liz and Rob, thinking about that data and those measurements, and unfortunately my colleague Pam, who is all things fabulous and quite often here, I think, with business intelligence, we have been developing that data dashboard that is allowing us to track, first of all, the impact of what's going on in households, but importantly as well, where we need to be working and doing what, and then how we show that we're making that difference and what we want to see. And I think that's probably worth a follow-up conversation with Rob and Liz around that. We also want to make that publicly available, particularly to our members and fellow officers, so they can see what's going on and the difference it's making and what might be useful, and we're working hard to get that just right. Doing this allows us to genuinely see through all of that strategic work in the wider inequalities plan and the county plan, how we're making those best value arrangements together as an integrated system to really see those inroads, yes, to manage the poverty and hardship bit, which is the thing that gets me out of bed in the morning, but also to be developing those longer term place-based solutions in partnership. This is just a snapshot. Now, Pam and I, what we thought would be helpful is if members of the board were interested to do a separate workshop where you could have a play on the dashboard. It doesn't really work terribly well on this screen because it is really interesting and shows that this is the cost of living bit. So what we can see here, we thought this was probably the most useful slide, and as I say in Pam's absence, is that households that are living in the most deprived situation, obviously spending much more on housing, fuel, and they have less income. And that just shows, and what you can do on the dashboards is actually toggle across all of those incomes, across wards. We can see house prices, we can see utility costs, household incomes, the cost of fuel, anything that you think. So we can see a real picture of households, and it's a very interesting and useful tool to just understand what life might be like and what might we want to programme and think about in these places. I'm mentioning the lift tool. We've only had this a short while, And I won't go through the slide, but basically what the Low Income Family Tracker tool allows us to do is, with a social policy engine that drives us, allows us to see across our residents where we have entitlements for income maximisation, where we should be a bit worried, where we've got children, where we've got rent arrears and things like that. And that should help us deploy our services and our activities in confidence, and also make sure we've got the right information in the right places, in partnership with the likes of our community hubs and community spaces and our libraries and our leisure centres, as well as our local shops and our hairdressers and so on. These are places where our communities go. So this should inform us, one, what we're doing with our household support, but also where we're putting good information for self-serve, which is really important, because quite often in poverty and hardship language, we forget to talk about residents having agency and choice, which they do, and skills and talents and all the other things, and their own lives, and we want them to be the best they can be. So within the plan, and as I say, the details in the report, our approach is obviously the Household Support Fund, which everybody is familiar with, and we work really hard with Northumberland Communities Together to ensure that what we do, that makes sense. So you'll know we continued with the free school meal holiday vouchers. We know why we do that. We have a rationale. We make payments that are in line with our energy pathway to ensure residents are warm, and we know why and where we're doing that because we're using our data to check, and we're working together. We're also complementing that with those community events, the warm spaces and the pop-up, in partnership with Citizens Advice and with our colleagues in the communities who've got the relationships with our residents, which is really important. What information needs to be in places? That means sometimes we don't even need to be there. Sometimes we do pop along and have a chat and let's know what's available to us and what's around. But also importantly, listening to what we're hearing and what we're seeing to develop those different solutions. We had a fabulous visit up to Wooler last week to a warm space, and there was soup on offer. Is it about food? Is it about food insecurity? Perhaps, but what it really felt like was social and friendship and wellness. And there's something really important in understanding how we draw that together and understand it. We've increased the Citizens Advice capacity, including the fabulous community advice model, which upskills people in place to be able to navigate Citizens Advice casebook and give earliest support and connect to the right, which of course then eases up Citizens Advice capacity too. Really putting that in place so if people have got a question, there's an answer there quite quickly instead of always a referral on. We've initiated, under Jill's lead, the Financial Wellbeing Network, bringing any partner together to make sure, again, we've got that good, solid, trusted information, but where it should be and who needs to know what, so that we get it right seamlessly in the moment at the earliest point. And that doesn't just tie to hardship support, but also things like savings, even pensions, and into next year we'll be looking at children and young people too. And Northumberland Frontline, which I hope you're all familiar with, which is a self-serve and partner referral for health and wellbeing options in Northumberland, which going into next year we will be weighting towards activities in our community spaces to really start building that social infrastructure, social capital, all the things that we know make that good life, which is exactly what we're all talking about. I've mentioned a little bit about access to food and sport. You'll know we have a hardship support offer around food that's directly connected to the Household Support Fund, but we're working hard with partners across the council who do much of that hardship support to understand, and we've funded a number of pilots on this really loose map, and I apologise that that's what it is. That shows my technical ability with mapping. But those were the areas we've invested in, different models of community food that are connected to information, support, socialisation, growing, teaching, learning, different things. And I look forward to coming back next year and perhaps talking to you about some of the insights as those models take shape, particularly over the winter months. And these partners as well, because that building relationship and working together means they can contribute to our Northumberland food strategy with real voices from people who are accessing that support to help us understand what local, affordable, well food looks like and means. We can never forget about children, particularly a colleague in the room here. And we have continued, as I've said, the holiday voucher support through the cost of living beyond COVID, which has been really well received. I mean, to the value of £250 per child, which is incredible in this time. And that's been intentional and really important. And the holiday activity and food programme, which I'll talk a little bit more of in a bit, and Healthy Start uptake. You know, there's a lot of space in what we have already that we are not maximising. So we're figuring out how we do that. And again, going back to that LIFT tool, we're fortunate to know where our families are, where these entitlements are. using that tool. So how do we put that good information, working with partners in family hubs, but also in our early years teams going forward into next year's policy development, where we'll have increased provision. And anybody else who's working with children and young people, toddler groups, soft play, it doesn't matter. What is the good and accessible universal information we need to work hard to put out there and to know where we're going with it, because we're checking it against the data, and then to look back and to see what we've learned. Have we seen uptake? Where did we see it? What did we do? And so on. And free school meal auto-enrolment, and working with education colleagues and others to see how that's built into when children register for school. How can we tick that through? And that is a national push, again, not only for households, but also that makes a difference to our schools in terms of the investment that comes directly to them. Colleagues mentioned the energy pathway, a great example of working in partnership and really making sure we can get the right support to households as quickly as possible, but importantly, again, tied into that energy audit and resilience building. I'm quite fascinated by the foil thing that goes behind the radiator, but we've got teams across the county who have these in the back of the car, and they visit and they say, oh, we could do this, we'll get you warm first of all, and then what, and then what. And on top of that, the Integrated Care Board had allocated significant funding for us to work with people who are at greater risk of cold homes through various conditions, whether it be respiratory and so on, to then support them to access the government grants, to access more intervention to really ensure that those houses and homes are warm, again, so that warm home and health. And we're working with the log bank as well to understand how do we understand when people are accessing the log bank, is there something else, is there something more sustainable, is there something longer term? So energy pathway is very, I mean, there's no questions, high demand for that at the moment in terms of that support, but all of the time triaging to see, is there more, whether it's entitlement, whether it's efficiency measures, and also feeding those insights back to our utility partners. Giving children and young people the best start. Fundamentally, while we're going through the cost of living challenges, it's really important that our children can still see and access the opportunities that are available to them. And sadly, that's not always the case. Children hear more than we ever think they hear, and they know and pick up more than we ever think they know and pick up. So the first thing we did last year was set away the Eat, Sleep, Play, Learn Fund, which was an allocation directly to support children and young people in an education setting with anything that gets in the way. That could be a travel pass, it could be a light buggy so mum can get on the earlier bus so that the wee one can get to the early years provision on time, and these little barriers that just get in the way. Importantly, the insights of what we're learning from that as well to help us inform going forward. What does provision need to look like when families are having a difficult time? What is in that space? And it is interesting, and I know certainly there's a couple of things we've done in partnership with some of Graham's colleagues in Children's Services that have shifted the way planning is done. This is the thing that made the difference. So it's a short-term support, but sometimes it's a short-term support that informs the long-term support that we have around families. The map here also shows our holiday activity and food programme, which is the holiday provision targeted at free school meal children with 15% discretion. Really important, because we have some families who just have a really difficult time in the holidays for complex reasons. This is led again by the data where our free school meal children are and building local capacity. It's community led. My colleague Amy coordinates that. And again, it's the holiday provision, but it's also the relationships with those local providers, those relationships with those places, with those village halls, those community organisations, and for us to also understand how citizens advise, how other information is leaning into those, and we're getting increasingly very good at that. And in fact, last year I had an external evaluation that fed back the difference it was making, yes, to school readiness and the things that the policy is set out to do, but also in families feeling more connected and supported and more ready and able in their own communities, which is great. We have an education-based intervention, and this is very much around learning what makes the difference. So again, going back to Rob and Liz's presentation, is seeding small activities that schools and other colleagues in education were saying, if we could do this, this would make a difference. And then for us to be pulling those insights forward and taking them into children's and saying, how do we maybe think about this going forward? So there is support to learn interventions, there's support for schools. Some of it is very simple things, like they've got nurture rooms that are a bit dilapidated, and it you know, the spaces where teachers get to have one-to-ones with children and things like that. We've got some innovative activities around food and learning to make sure that, you know, one, yes, the free school meal uptake is taken up and that children are eating through the day, which is really important, but tying that to food education, which ties to other strategies, showing that integrated approach. And Global Bridge, which is interesting, and my colleague Neil leads on this, which is a CV tool for other skills other than just your formal education, where children can create videos and audio and they create their own little web page which can be shared with employers to have a look at. It's just a really, and I know it aligns really well to the work of the Trust with the Community Promise in terms of looking at those routes into employment and how do you articulate your own talents and successes if a traditional CV and qualifications model doesn't work for you. The family support role, which is specifically for children losing traction in education connected to poverty, domestic abuse and protected characteristics, and we're already seeing some really interesting insights coming forward through that. The early years planning I've popped on here because a lot of this work is about building partnership. They're small activities with mixed groups doing different things in places. And obviously we're coming forward into a very different space for early years provision. And it's great to be bringing colleagues together to be asking questions about how we're planning for that, to ensure that that planning includes that inequalities lens when the time comes, so that we're making sure that the provision we've got is where we need it most and at the quality that we want. And that's workforce planning and everything else as well, because when you're meeting up to 10,000 young people in the summer, you really want them to know if there's job opportunities coming, and you want to be having those conversations with them. And and apart from anything else, young people are really interested in policy. Who knew? But they love to be part of it, and that's exciting as well, because these plans are long-term plans. Community resilience is at the heart of everything that we do. You know, hardship support's important, but it's the what next. So I've mentioned about making sure we've got information and support, building relationships, and that community advice, as I say, doing it with citizens' advice, but with others. All that good information that we all have, how are we sharing that? How do we co-locate? How do we know each other better? And that's across all of the sectors. We've built the cost of living website. The footfall on that continues to drive, and we meet monthly to look at where residents are clicking to make sure that that information is up to date and constantly looking at seeing what people are searching for. Similarly, Frontline, growing organically month on month, and again, as I say, this coming year, really weighting that towards need. The MET, financial wellbeing, making every contact count, aligning to that financial wellbeing network of how are we making best use of the information we've got, and working hard where we need to work hard in the way Marmot would have us, and relying on community partners where it makes sense as well. And that community embedded capacity. Obviously we have Northumberland Communities Together. We've got a rural advocate role up in Wooler, who is doing some incredible work building rural ambassadors and importantly telling us the stories, listening to what's working and making a difference there, and really seeing excitement and energy, because that's what we need is that, yes, this is where we can see where we're going. Reading for wellbeing coaches who've been with us a while. How are we deploying that to need where, we are working with books and stories, and you can go to early years, but also people who are discharged from hospital, loneliness, warm spaces, the opportunities for that. Hello Hurst, of course, the work we're doing in Hurst Welfare, and employability on a page. If we can simplify things, because we're all working in employability, how do we do that? How do we make things that people can access easily? The Population Health Management Fund was allocated through the Integrated Care Board and is managed through Thriving Together, and that's test and learn. It's really interesting listening earlier on, because one of the things that the fund funded was young people using electric bikes to go to various employers that offered apprenticeships, and seeing how that was and how that connects with, somebody made the point, you can't travel from A to C, but perhaps you can travel A to B and then connect B to C and so on. And they're doing, but a lot of that is that just seeing what, these are our big ideas. How do we start proving, testing and seeing what we learn at a small level? Place-based solutions to health inequalities was how it was badged. And they're as small as at street level, and the report, as I say, into next year. So in summary, and I apologise, that is a lot of information, and I'm aware there's an equivalent a lot in the report. But our job with this plan is to keep the residents safe and well, going through the cost of living pressures with well-directed support that we're confident in is making a difference, to prevent the widening of further inequalities, and to be building that resilience and prevention on top of that support and crisis intervention. And to seed and learn those pilots and to build those collaborative relationships so we know each other to support this longer term preventative and proactive measures in the wider system inequalities plan and the wider planning from all the different areas of the council. Thank you.
Thank you very much, Emma. Thank you. It was a very detailed report, working on multiple directions, multiple dimensions. So thank you very much. Are there questions? Yes.
Yeah, this is a really, really positive report. Just for your information, we start to push out on our internal comms all the warm spaces in Northumberland. So we recognise our officers go into multiple homes where we're identifying deprivation and families really struggling, and that information is now on all of our officers' phablets in relation to what Northumberland have got. The next step that we're now looking at, though, and we've started within one of the other local authority areas, and I'm going to signpost my staff after this meeting to yourselves, is that link between early offenders for shop theft and recognising the potential link to deprivation, particularly committing those crimes to steal food. So the idea will be, again, we signpost those first-time offenders that maybe don't even come into the custody system or do come in the system but can be signposted to food banks or other alternative avenues to prevent them re-entering the attention of the police. So there's some really good things that we can do to support this as well, to support families rather than going down that criminal route. So thank you. We've started getting there with this, but I think there's more we can do.
Any other? Yes, Graham.
Just to say thank you very much. Overwhelmed by your energy and enthusiasm, really. You know, I chair the Inequalities Steering Group, but actually it's people like Emma that make most of that happen. And in terms of the work that you do, it's the closest to the communities that I know that we do. You've got the 3 mantra questions on there that we should always ask ourselves, which is just an illustration that how we've moved. Graham made the point about signing the inequalities thing last year. The system working that comes into this, though, on that slide that showed, we're thinking about population health management, we've got data, we're being data driven, it gives us assurance. I think it just illustrates how, although largely it feels that it's owned by you and you push the agenda, which is superb, the links that we all have and the way that we network around this just enhances it. So thank you very much.
Thank you, Graham. Very well put. Any other questions? Yes, please, Jill.
Not a question, but just a comment, and picking up on Graham's point, thanks, Emma, and absolutely your enthusiasm and drive and commitment is absolutely required for this. Hopefully, as a board, what we've heard across the 2 reports today is the bigger picture of the 5-year plan and that bigger push for longer term change, but also what we're doing in the now. And I think that's been always really important as we develop. Some of the potential cynicism is that that's all well and good, but what about my circumstances here and now? And I think what you've just described today shows the number of ways we're trying to work into and across and with our different communities to, as you say, mitigate the circumstances whilst we progress those longer term ambitions to reduce and narrow the gap that we do have. So thank you.
Thank you, Jill. It was very good. Abby, you wanted to say
Just
something?
a very quick comment. Obviously, I'm involved in an awful lot of that work, but it's really useful to see the sheer scale and volume that actually is under that portfolio, because it is massive. But it's really great to see the positive direction that we're travelling. And I think just to go back to what Liz said at the beginning about shared language and shared understanding, this is a really evident of kind of collaborative working, which none of this stuff can happen on its own. And, you know, as Emma kept talking about all the different partners that are involved in this, I think it's just worth mentioning that, you know, what you said before, Chair, about, you know, this being a cross-system and joint and things like that. And I thought that was really evident in that report. Thank you.
Welcome.
Sorry, thank you. Excellent report. Just picking up on your point, Julie, a kind of wider point about the impact of all of this. It's fantastic to have this sort of upstream conversations today. And I was looking at the implication sections at the back end of the papers, preaching to the converted here, because we all understand that the small injection up front has huge economic leverage down across the whole kind of, or each of the sectors. I just wonder if we sell the message hard enough. So there's a comment in this paper that says, represents value for money. Okay, kind of throwaway, doesn't say quite in what sense or where the evidence is. The comment on the previous paper was actually focused on cost, not value. And in both cases, we might, for audiences outside of this room, be missing an opportunity to sell again the idea of the downstream impact, which is quite significant in terms of value rather than finance.
Okay. Thank you. Any other, ladies and gentlemen? Thank you very much. Thank you very much, Emma. Thank you. And takes us to the item number 6, Health and Wellbeing Forward Plan. And I think in the next meeting we are going to drill down on housing related, one of the themes in what Rob just elaborated. And then in March we are going to put together and give it to you the joint health and well-being strategy plan. So if you have any comments on the future agenda, please email us. There is no urgent business, so which means that we have almost concluded this meeting. And thank you very much for all of you for all coming here and making wonderful contributions. That's what we want to hear. And this being the last meeting of the year, I wish you all a very Merry Christmas and best wishes for the new year. And in the first meeting, I will be away, so it will be chaired by Graham, okay? And the following meeting, Graham is planning to be away, so I'll be chairing one. So in March, we will be full team. Thank you. Have a nice evening, and have a nice afternoon, have a nice day. Thank you. Bye.